County Board of Supervisors meeting, recorded January 19, 2021.
I'm calling the Portage County Board to order. Dave? Call the Portage County Board to order. Roll call.
We have 25 supervisors present, 15 attending in person, and 10 attending remotely.
Pledge to the flag.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Invocation by Supervisor Splinter.
In less than 24 hours, our country will have a new president inaugurated, and we will have another peaceful transfer of power completed. The election split our country down the middle politically, but now we must heal and work together for the common good in a nonpartisan manner. I have always been proud of our county government here in Portage County, as I have seen how our nonpartisan form of government works so well for the common good. Let's pray that our national and state governments can now heal and also work together for the common good. Amen.
Thank you.
Review and approval of December 15, 2020 County Board minutes. Motion by Supervisor Dubeck, seconded by Supervisor Moore. Any corrections or changes? All those in favor with aye?
Aye.
Opposed? Motion carries. Correspondence.
County Clerk fill-in, agenda, meeting manager, and surface rollout update. I do just want to add a couple things to the memo that was included in your packet. So as part of this process, we have hit a couple speed bumps, so I appreciate everybody's patience as we work through and get things figured out. I did get confirmation from the IT department yesterday that Granicus, our current provider of agenda software and our website provider, is able to do the data export of all previous agendas and minutes that are on our current platform that you can access from the website calendar. There will be a dedicated area on our website after the transition to access those archives, so we won't be losing anything that's already on the website. There will be a new public portal for the public to access new agendas and minutes or current agendas and minutes, which will replace the way we access agendas and minutes on the website currently. The City of Stevens Point website is actually a great example of what ours will look similar to for the new portal. So if you are interested, you can go and check out the City of Stevens Point website. From their homepage, if you go to agendas, minutes, and videos, you'll see a page that offers their archives for their previous agendas and minutes. Ours will be something similar to that. And then there's a link to access their current agendas and minutes, and that will bring you to what is the public portal. So I would encourage you guys to check that out so you can kind of see what ours will look like in the future, near future. Couple other things. So for user accounts, I mentioned in the memo that you guys will be receiving user accounts for the new Civic Clerk program. A few of you have already received the emails to activate your account, so thank you for those who have already done so. The rest of you will be receiving links to activate your account shortly. Once you activate your account, you don't have to do anything else at this time. We'll provide you with training on the portal and how to do everything in there, navigate it, and then eventually we'll be doing voting in the portal or from the portal, so don't be afraid. We'll give you guys training on that as well when the time comes, but we'll have maybe a couple months before we do that. If you do not activate your account within 24 hours of receiving the email, just let us know and we can send you a new email. Not a big deal. And that's it for user accounts. I guess the last thing is, just as I had mentioned in my memo, the IT department is working through issuing Surface tablets to everyone. So just be on the lookout for that. That'll be coming out. I think their plan is to get that done by the end of January. So does anyone have any questions?
Supervisor Dubek.
For the civic clerk to get the like login email, who will that come from? So I don't not it's legit and not spam.
Sure. Let me look up what it says. It does say like Civic Plus, and I think it's kind of like a longer name. If you would like, before I activate any more accounts, I can send you guys an email to say this is what it's going to look like, so you know that it's not spam. So.
Also, if you get an email from me asking you to pick up gift cards, I've gotten 3 or 4 of those, don't do it.
Don't do it.
I think Supervisor Moressi's got one, I think Supervisor Johnson's, Supervisor Splinter, so they like sending those out with my name on them, so ignore them. I don't need gift cards, so. Any other questions for the clerk? Okay, moving along. Presentations. Fang Vang background on Hmong New Year, and we have a presentation.
Hi, can you guys hear me?
Yep, go ahead, sir.
Okay, thank you for inviting me. My name is Pong Vang, and I work for CAP Services for the Hmong Uplift and Interpreting Services. Today I'll be talking a little bit about the Hmong New Year. The Hmong are members of the ethnic group that have not. Can you switch to the next slide? Okay, the Hmong are members of an ethnic group that have not had a country of their own for thousands of years. The Hmong have lived in southwestern China, but when the Chinese began limiting their freedom in the mid-1600s, many of the Hmong migrated to Laos, Thailand, and surrounding countries. During the Vietnam War, the Hmong in Laos aided the partners with the American force to fight Southeast Asian communists, which is known as the Secret War. After the United States pulled out of Laos, communist force began retaliating against the Hmong, which many died and also fled to the neighboring country, Thailand. Many of the Hmong eventually resettled in United States, France, Australia, and other part of the world. Next slide. So the Hmong New Year celebrates a cultural traditional that takes place annually in selected areas where there's a large population of Hmong. During the Hmong New Year celebration, many of the Hmong dress in traditional clothing, enjoy traditional food, dance, and many sports. Hmong New Year celebration frequently occur during November and December, traditionally at the end of the harvest season when all the farming is done. Right now, serving as Thanksgiving holiday for the Hmong New Year due to the cold weather in Wisconsin. Portage County hold their annual Hmong New Year festival usually in September at Lake Pakawa. Historically, the Hmong New Year celebration was created to give thanks to ancestors and spirits, as well as welcome in the new beginning. Traditionally, the celebration lasts about 10 days, but since in America, due to difference between traditional farming schedule and other work schedule, it has been cut down to only a couple of days. The Hmong New Year celebration is specifically based on both religion and cultural belief. as in-house ritual that takes place annually in every Hmong household. The celebration is to acknowledge the completion of rice harvesting season, thus the beginning of the new year, so that a new life can begin as a cycle of life. Also, during the Hmong New Year celebration, house spirits, as well as spirits of wealth, called Suga, are honored. In addition, if a shaman is in the house, the healing spirits of the shamans are also honored and released during this time, until they call back for the new year. Next slide. So with working at CAP Services under the Hmong Uplift program, it's a multi-generational literacy program. Within the program, we focus on adult education, parenting education, early childhood education, and parents and time together. We also have the Hmong digital literacy class, provides computer skills, English, and job searching skills. We also offer the Hmong enrichment class, which teaches Hmong culture and language. And then we also provide civic engagement, such as voters, outreach, and education. And then in the midst of the COVID, we also started the Shipa meal program, which also provides meals to Hmong elders and disabled. And then we also do interpreting services. Next slide. So in short, that's all I have for the Hmong New Year. Thank you, and Ocho. And I could, if there's any questions, I can help answer.
There we go. Any questions from the? I know that I had been invited by the supervisor to go to the Hmong New Year. This was quite a few years ago, and it was quite a gathering. The dress, formal dress for the dance and stuff was quite elaborate. It was very interesting, and I would encourage anybody when they have that to be able to attend that, take the opportunity to attend. So, if there's no other questions, oh. Supervisor Johnson.
Thank you, Mr. Chair, and thank you, Mr. Bing, for sharing the information with us. I wanted to thank you for doing that. It's our first introduction as an entire board, so it is deeply appreciated. I too was invited to the most recent in-person Hmong New Year event at Lake Pakwa, which was a little over a year ago. And I was struck by the amount of military pride that many of the men displayed. They had their military medals and showed their distinct pride and their connection with the United States of America and having served along with our troops. It was very striking and very moving. And I would encourage anyone who has a chance to attend when we're again able to gather together to attend the Hmong New Year. The food is great, the celebration is wonderful, and the reception is absolutely warm and welcoming. So thank you, Mr. Vang.
Thank you.
Thank you, sir. With no other questions, we'll move on. Health and Human Service Director Shabilsky, County Executive Holman, COVID-19 update.
Good evening and Happy New Year to everyone. This year into 2021. We promise it's going to be a better year, hopefully. So where we're at quickly with our numbers. As of today, we're at 5,497 positive confirmed PCR tests. We have had a 7-day average of positive confirmed PCR test of 15.86 tests a day. So we're getting about 16 positive tests every day. We are at 24,307 negative tests. We currently sit at 256 hospitalizations since the start of the pandemic. And fortunately, we have been fairly stagnant with fatalities at 57 for about a week. So currently we have 144 active cases in Portage County, 5,730 recovered cases, and of course the 57 fatalities as I mentioned before. Quickly with our testing data, we continue to test 3 days a week. On Mondays, we still have wing testing, which is the National Guard. This is all at the ADRC, drive-through testing. So the National Guard is testing there on Mondays from 9 to 5. We have our own testing on Tuesdays from 1 to 5 and Thursdays from 9 to 1, weather permitting. But knock on wood, so far we haven't had to cancel anything, although I think today's forecast was scaring people a little bit, but it wasn't too bad is what I heard. So we have, our testing numbers are down. They're down significantly. We tested like 1,200 people, or actually 1,277 people in October when we first started. In December, we only tested 634. So far in January, we've only tested 182. So we are down. We didn't have wing testing yesterday because it was, of course, the Martin Luther King holiday. But for January so far, we've only had about 95 people tested on wing testing Monday. So the testing is down. Yet with that being said, we're still at about an 18% positivity rate. So we're about 18% of the people we test are coming back positive with that. So in total, what we've had here since the start of our testing is 451 positive tests of Portage County residents, and then 74 positive tests for people outside of Portage County. So that's our testing, because right now we're looking at our three-prong approach. We are testing, we are contact tracing, and the big bugaboo in the room is we are vaccinating. And everybody has questions about vaccinations. When is it? Where can I get it? How fast can I get it? And the bottom line is there's a number of factors that have come into play with our vaccination efforts. We know how to vaccinate. My nursing staff is really good at vaccinating people. We've done mass vaccinations for years. But this is not your typical vaccination. What we're dealing with here is a product, or products, I should say, but in our case, we are dealing with the Pfizer vaccine. Logistically, we get Pfizer vaccine released from the state. It comes to the hub, all right? And then when it comes to us, it's no longer in super cold storage, because this is the one that has to be minus 80 degrees Fahrenheit. When they take it out of super cold storage, you put it in your freezer, 5 days. You have 5 days to use whatever they sent us. So if we ask for 100 doses, which there's 5 doses in a vial, okay? So those 20 vials, you have 5 days to use those vials. When we take it out of the freezer, we have 5 hours to constitute and use that vial. That's it. Otherwise, you get beyond those time periods, it's gone. I think where people are frustrated are the fact that they're looking at and saying, well, I want it, order it, let's get it done. When we were talking about a flu vaccine and where I could put thousands of doses in my refrigerator and keep it there, and if I took it out, as long as I didn't have it at room temperature for more than like 4 hours, I could put it back and I could use that. And that's the way we were getting vaccines done. This is very different logistically on how we have to get this done. With that being said, people are saying, all right, who's a 1A? Who's a 1B? The state has not yet officially released their 1B list yet. We haven't gotten it. Now we know things have changed. We know that they said that they moved up law enforcement and firefighters. We know that they said it was 70 above. Now they said it's 65 and above. At first they said it's 65 and above starting next week. Then the governor said today, starting today. Oh. We should have told us, Governor Evers, but okay. So here's the thing. The more providers we get on board, so our local health system, so Aspirus, Ascension, Marshfield Clinic, the more pharmacists we get on board doing this, the more vaccines that there will be given. The more vaccines given, the more availability there will be, and there will go. And that includes us. So our intention is right now that we are looking at hiring one, if not two, vaccination teams. What those vaccination teams will do is supplement our current staff. Because again, our regular work, our other work didn't stop. And people are saying, well, I heard the county is only going to give out 60 or 70 vaccines this week. That's right. That's what we're going to do because that's about the maximum we can do with our current capacity. We're looking at expanding that. We are looking at by the first Saturday in February to start a Saturday clinic, which we're looking at 100 to 200 vaccinations every Saturday. We will continue to work with our providers to inject as many people that want to get the vaccine. That we're really excited that people want to get vaccinated. That's a wonderful thing, and we want to do that as quickly as and as expediently as possible under the conditions that we have to deal with. So, people are concerned in regards to the amount of vaccine coming into the state and that issue. But I'm going to ask Chris to talk about that a little bit because he's done some research on that for us. So.
Thanks, Ray. And when Ray says research, he means we've been bombarded with questions from the public about what's going on and where's the vaccines and how does this all work? Because a lot of the times, well, it's kind of a symptom of everything being pushed to local health departments, like coordinate with them, talk to them, so people get it in their head that we're like vaccine headquarters. Now, we're certainly coordinating, but there's 1,100 vaccinators in the state, and we're just one of them. And we're obviously planning robustly with the hospitals, EMS partners, everybody in the county, volunteers, we're working on that as well, just so that, when the supply of vaccines amps up to meet the capacity that we're putting in place, the framework for, that we'll just be able to go. But for now, if you've been following the news, you've been seeing some of this, but I figured I would articulate a little bit about where does the process start? And where it starts is at the federal level. So the CDC has a committee on immunization practices, and they set up the framework. They say, here are the recommendations and guidelines that the states must follow. So they kick that down to the states, and the state's equivalent committee, which for us is the State Disaster Medical Advisory Committee Vaccine Subcommittee, takes that information from the CDC committee and then kind of parses it out. So like for Tier 1A, I think they had 11 different prioritizations within what they received from the feds. And so they then kick their recommendations and guidance to DHS, which says, all right, here's the answer, and they get it to the local vaccinators, and then we vaccinate according to that information. It seems like a lot of bureaucracy, and it is, but the thing about it is that you really need to have everyone on the same page and everybody doing the same thing rowing in the same direction, because it really is a national scale project that we're working on here, and we're implementing it at the local level. So in terms of supply, the governor and others, many states, in fact, are kind of saying, we need more vaccines. And so just to give you an idea, with Tier 1A, when that started going, that was healthcare personnel and long-term care facilities. And just healthcare personnel is 485,000 people in the state. And we've been going at this for about a month since they got emergency use authorization for the vaccines. So in 1 month, we've received roughly 470,000 doses. So that doesn't even quite cover Tier 1A, but now we're starting Tier 1B, which was somewhat expected because these things are fluid and going to be run concurrently. But the other factor is that these vaccines currently in use need 2 doses. So you need 485,000 doses for all the healthcare personnel times 2. Now Tier 1B has 700,000 people in it. And so you need 700,000 doses times 2 for Tier 1B. Now, we're getting roughly a third of what we need to keep up with the rollout in terms of who's able to go and get the vaccine. And I think everybody's anticipating that the federal, the kind of link between the manufacturers, the federal organizations, and the states is they're going to iron out their wrinkles and figure out how to get us more. Just because you're generating a lot of this anxiety and anticipation, especially by opening up more and more people to the vaccine. So if we kept the same pace, for instance, just as an example, it would take us 5 months at the current pace to get through Tier 1A and Tier 1B. So that's why I think it's safe to say that we'll see an increase in the supply, but also what you're going to see probably towards the end of this month, maybe start of February, you're going to get more buzz about a vaccine from Johnson & Johnson, which is coming to the end of their phase 3 trials. So they'll get the data to the FDA, and then the FDA will go through it, determine if it's safe. The same process for the others. Johnson & Johnson is interesting because it's only a 1-dose vaccine, so that would help logistically, and also just getting people vaccinated. And then AstraZeneca is also in the same position. So if those two come online, not only will it be more vaccines from different manufacturers, they're also different technology. So logistically, they don't, like AstraZeneca, you can just refrigerate. It's not as big of a deal. So that makes it easier to distribute. We don't have the capability to store it locally. There's been people asking, why are you holding vaccines back? As Ray said, we get them, we administer them, and that's it. Because we don't have a super deep cold freezer to put it back into for Pfizer. 1C, the tier 1C is currently under discussion by that state committee I mentioned. And if people in the public want to provide public input to them, they have a space on their website. You can search DHS vaccine and you'll find this committee. And then there's this, they have their meetings very similar to our meetings where you can send in whatever your comments are. So I've redirected people there from time to time and shared their stories as well with people so that message is getting to folks. But yeah, so essentially we're at the end of a very long chain, and we're ready to go when the vaccines show up. And so it's just a matter of, it's a waiting game in some respects. But in the meantime, we, hospitals, clinics, others are vaccinating the doses that we have on hand. So if you do look at the numbers, it does increase steadily each week. So it's a slower beginning of the rollout, but I think everybody anticipated that. Plus, I think everybody also knew from the get-go that nothing about this is going to be easy. But the vaccine progress was good, and so now we know where everything is, we know where all the challenges are, so it's just a matter of fixing them. Any questions?
Any questions? Supervisor Barry Jakowski.
Thank you, everybody, and thanks for the information, fellows. I'm just wondering, are we making plans for, as vaccines become available, to do mass vaccinations, either rolling people through Iverson Park or Turkey Field or something? Are we setting the groundwork for that?
Absolutely. We're in current discussions, and we've had offers from a number of different places in the community that said, hey, when you want to do this, let us know. So, everything from UWSP, their MAC, which is a really big space, to we've had offers from, for local drive-through. So things like that. So yes, we are talking about that. Absolutely. I mean, the key to that will be that we are, that we just have the vaccinators, and that's where EMTs become real important. And we're getting emails every day from retired nurses saying, hey, I want to come back and help. And as long as you got your license, you're good. The one thing I do want to mention though, is if you're very interested in where vaccines are at, and even in Portage County, they do have that now on the DHS website, and it's only updated every Tuesday. I do want to let you know that, but as of yesterday, there has been 1,717 vaccinations done in Portage County. Okay. Doesn't sound like a lot, but it's a start, and we're keep moving in the right direction.
Supervisor Pataki.
Can I just add?
Hang on, Stan. Hold on.
I just wanted to add too that in addition to our mass clinic planning, the state is also working to find a vendor to do state level mass clinics. So they're going to be doing mass ones. We're going to be doing mass. You have the hospitals, which are, they're set up for the testing already. So they'll probably just tweak that a bit. But yeah, that will certainly happen.
And the pharmacies as well. Supervisor Pataki.
Thank you, guys.
Ray or Chris, the Pfizer and Moderna, the protection supposedly is 94.5 and 95%. These two vaccines, do we know what the protection for those are?
I have not heard that, but
no, we don't know. We won't know officially. There's, I don't want to really speak too much about it because most of the conversations about Johnson & Johnson and AstraZeneca have been via press release, which is not really a good way to look at this. We really should wait for the phase 3 data for each of those trials to come out and say definitively what it is from the research that they've done, especially because like Johnson & Johnson's trial has been here in the States, but like AstraZeneca's got trials all over the world. And so we want to make sure that the trial we're looking at is the one that's applying to us. And so that, you know, other countries have authorized that one already. They were in the 60 to 72%, depending on how they calculated the numbers. But just as a reminder, when everybody started this race to the vaccine, the stated goal was 50% efficacy. And so everyone's so far looking to be either blowing that out of the water or far surpassing that. So, but yeah, once we have that official data, you'll get a lot more press releases then, but it'll be actually with a link to research you can read rather than somebody's interpretation.
Couple things I want to just say though too, and Chris and Ray and I sit in on a lot of Zoom meetings and hear about this, and even when you're going over it, I was writing a few things down that I was thinking about that maybe you hadn't mentioned, is us having the Pfizer versus a Moderna with the cold storage throws another wrinkle in there above and beyond trying to coordinate it normally. And the other part was when we ask for a certain number, we don't know if we're going to get them or when we're going to get them, because I think I've heard that once before too, Ray, or has that gotten better?
Well, yeah, that's better. I mean, we typically know when we're going to get them, you know, because they basically are saying that, you know, when we make our request, you know, they deliver right now on Mondays. That's why we're doing Tuesdays, Wednesdays, and Thursdays, because it kind of gives us the maximum amount of time that we can expand it to. But they've been pretty good about that, Al.
Okay, and the other thing is when we talk about doing mass shots and going through large groups, you can give someone, probably run them through there in 3 to 5 minutes, you can give out shots, but the people are required to stay 15 minutes afterwards. That's where the stacking up comes, and then you have to social distance and keep 6 feet apart. So you can see the logistics part of it and making sure you have a place where you can observe those. And Ray had said some places were doing drive-through, but it's like, it's kind of hard to monitor someone when they're sitting in a car in the parking lot, so.
That's true. And if you had a history of allergic reactions, recommendation is 30 minutes of observation.
So, Supervisor Soik and then Supervisor Zastro. Supervisor Soik?
How many, if any, vaccinations have had to be thrown out?
We have not thrown out any. I can only speak for the Public Health Department. We have not thrown out any. Because you know, if we have an extra dose, we're going to find an arm to put it in.
Mm-hmm.
So.
Supervisor Zastro?
Thank you, Mr. Chair. This is for Director Shabilsky or Executive Holman. Is there any cost to be incurred by people getting these? You know, I understand if it's at the county, probably not, but for administering it. But what if you go to a pharmacist?
There is no cost to the individual. People have talked about, you know, collecting insurance information because, you know, for like those third parties that you're talking about, so pharmacists, you know, healthcare systems, they can get reimbursed for the injection part, but at no cost to the individual. So they can't run that through and say, oh, but it's part of your deductible. That doesn't work. So it is at no cost to the individual. They may ask you for that information, but only because they're going to just try to offset some of their cost for the actual injection itself.
Thank you.
Supervisor Barry Jakowski.
Thank you, Mr. Chair. We talk about the different vaccines that are out there and available and going to become in all actuality probably available. Can we request, like the Moderna, I realize probably the Marshfield Healthcare Center at Marshfield has the ultra cold storage, but we don't have that capability. Are we able to request, if we're obviously doing the Pfizer now, can we request the Moderna so we could have more on hand or take delivery of more?
Well, and even the Moderna has some logistics around it. I'm just real familiar with Pfizer because that's what we get. But we were told originally whatever we got out of the gate, that's what they were going to send us. So, but again, Moderna is in our community because, you know, I believe Aspirus has Moderna. I'm not sure what Ascension has, but it's in our community as well.
I think I'd heard on one of the calls that both of the Ascension and Aspirus both had Moderna.
Yeah,
I think I heard that. Supervisor Medine?
Ray, when you mentioned about 1,000 vaccinations have been administered.
1,700, yes.
1,700. That could mean either 800 with 2 doses, or it could mean 1,700 people with 1 dose. How many, can you give us a little bit of
It's much closer to the 1,700, and the reason is because we have not done any second vaccination yet. And I think that most of our healthcare systems, which really got the early start to it, because again, we've only had vaccine for 2 weeks. I think some of them else have had them about 4 weeks, 3 to 4 weeks. If you're Moderna, you're talking 28 days. You have to wait 28 days. And that's the key to that 28 and 21 days. People are like, oh, I have to get it on day 21 or day 28. No, you have to wait 21 days before you get your second shot. Or 28 days, depending on which vaccine you have.
So Ray, then with the 21 or 28 days, I think I've asked this before, if you don't make it on the 21st or the 28th day, the leeway?
There is a lot of leeway there. As you may have heard, there's been talk federally to push this out to where everyone gets a first dose. Everyone gets a first dose, and we're going to worry about the second dose later. What we've been told, and I was just on a call today, that basically if you have 1 dose, you got about 65%, coverage, if you want to look at it that way. If you wait a month or a month and a half or 2 months, whenever you get the second dose, that's when you're going to go to that 94.5 or 95%. So it's not like if you miss the day, the 28th day, you're going to go downhill. You just don't have as much protection as you do with the 2 shots.
Supervisor Medine, you had your hand up?
Yeah, just to follow up, at the county home, they had the first shot was 2 weeks ago. The second shot will be administered by CVS with Moderna on February 3rd.
Yes, that is correct. That is correct.
So that's pretty close to covering all of the 1A.
Well, it certainly is going to cover both of our skilled nursing facilities on that day. There's still a lot of people in assisted living that we haven't gotten to yet. So
private.
Yes, correct.
Anybody else? Supervisor Barry Jakowski.
Yes, and sorry for taking everyone's time, and thank you, Mr. Chair. When we talk about the approximately 1,700, that's what your department has given, because
oh, that's countywide. That's countywide.
Hospitals and
that's hospital systems, skilled nursing facilities, and us.
Okay, because I was just at my doctor this afternoon, and he just got his second shot, and that was at Ascension. Excuse me.
Soon to be.
I was just wondering whether. Yep. But thank you.
You're welcome.
Anybody else? I want to thank Ray and Gary. I hear nothing but good things from people in the public. This is really a daunting task. And I guess if anybody has questions, don't hesitate to call myself, Ray, Chris, and if we don't have the answers, we'll get back to you.
Absolutely.
So, thank you. Supervisor Pataki, you're muted. Go ahead.
Question, if Portage County has an allotment, can other people from other counties come here and get shots?
Yes, but we are catering to Portage County, Stan, but honestly, because the vaccine comes from the federal government, you don't have to be a county resident to get it.
Okay, thanks.
That's why people
Okay.
are going to Florida.
Thank you. Public notice. Members of the public who wish to address the county board on specific agenda items must register their requests at this time with such comments subject to reasonable control of the county board chair as set forth in Robert's Rules of Order. Anybody from the public? Okay. Resolution and ordinances. Number 1, recognizing the Hmong community and the virtual Hmong New Year celebration.
Resolution number 69, 2020, 2022, submitted by the Diversity Affairs and Inclusiveness Committee. This resolution recognizes and celebrates the Hmong community in Portage County. I do just have a recommended amendment, very minor, but on the back page of the agenda or of the resolution, the committee name for diversity and affairs lists inclusivity instead of inclusiveness.
Let's get it on the floor first. Motion by Supervisor Johnson, seconded by Supervisor Moresi. Someone want to make those amendments so that we can take a motion on those? Supervisor Johnson, go ahead.
Oh, thank you, Mr. Chair. Yes, it was a clerical error on my part. I apologize to my colleagues. In my mind, I was using inclusivity and inclusiveness as interchangeable, so it should be inclusiveness.
I have a motion for an amendment to add inclusiveness. Can I get a second? Seconded by Supervisor Dubek. Any discussion? All those in favor with the amendment, say aye.
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 Opposed?
Aye.
Supervisor Pataki, you're opposed or you're just delayed?
No, aye.
Okay. Just, with no one opposing, motion carries. Now back to the original, as amended. There's no further discussion.
I have
Supervisor Neville.
I'm very excited to see this resolution coming to the board. When I read the last part, I was concerned. I'm hearing a lot of noise.
Very difficult to hear her.
It is. I'm hearing noise when I talk. I can't hear myself. Okay, I'll try again. At the end where it says, we'd like to do this by collective endorsement of the events of the 2020 Hmong New Year virtual celebrations. Can you find that? It's right at the bottom. Okay. I'm concerned to say that I endorse the events of the 2020 virtual celebration because I didn't attend any of the events and I don't know what the events were. And I know they took place over time. And I'm just not comfortable saying I endorse something that I had no direct experience with. And I'm wondering, I'd like to hear what other people think, but I was wondering about possibly, I'm not making this as a motion right now, but I was thinking changing it to by the endorsement of the 2020 Hmong New Year and leaving the rest of that part out.
Anybody else have any comments in response to Supervisor Neville concerns? I guess, Mildred, if you feel strongly enough, you can either make an amendment or you can vote in the opposition of the resolution. Those are your two choices as I see it.
I should also have a choice to say.
Or Mildred, you could abstain. You have a third choice as well.
Mr. Chair, nobody have any thoughts on that? Does it seem?
I'm here and I asked the group and no one raises their hand. Nobody has any comments in regard to that. Nobody online has any comments as well.
Thank you.
So if there's no more further amendments, we're back to the original as amended. All those in favor with aye?
Aye. Aye.
Opposed? Motion carries. Number 2, resolution recognizing MLK and asking administration to formalize a diversity training day for employees in 2022.
Resolution number 70, 2020, 2022, submitted by the Diversity Affairs and Inclusiveness Committee. This resolution recognizes Martin Luther King Jr., his legacy, and supports the development of diversity training for Portage County staff. I do have, one moment, another suggested amendment to replace inclusivity with inclusiveness in 3 different spots in the resolution. And also the date is listed as December 30th. And that should, well, I don't know if that's supposed to be was that supposed to be the committee date as December 30th?
The other one was that as well.
Yeah, Clerk Phelan, yes, that was the date of the committee meeting.
Okay.
Yeah, that's the end of the month. I have, is that a motion by Supervisor Moresi?
Yes, I'll make a motion to make those amendments.
I need to get it on the floor first. I'll just take a motion to get it on the floor.
Yes, please.
Seconded by Supervisor Johnson. Now we can go back to the amendment. You'd like to amend the inclusiveness?
I will
Moresi?
propose an amendment as Clerk Phelan has suggested, and then I'd like to add on one more amendment, please.
Go ahead.
It's in the second, therefore be resolved. I would like to add for Portage County and the Portage County Board of Supervisors. I think it is very important for us to continue to strive for excellence, and educate ourselves on issues of diversity, equity, and inclusion in our community. I think as long as we are making amendments, I'd like to add that small sentence in there as well. Thank you.
Mr. Chair? Mr. Chair?
Supervisor Neville?
I was unable to hear what his was because of the noise. I didn't understand it at all. I couldn't hear.
Yep. We're having some technical difficulties here. I'm going to ask Supervisor Moresi to repeat that in a minute here. I have to mute the room. We're getting feedback, and we're in the control booth right now trying to make some adjustments here.
What is he amending? What is he amending so I can?
The second whereas.
The second.
Or, I'm sorry, the second now therefore be it resolved.
Mr. Chair, can I ask a procedural question? One is a technical amendment, and the other one is kind of an amendment to the language. Should we take those as 2 separate amendments?
I think so.
Can we concur to do that as a body?
Yes.
That sounds good.
So we're looking at the technical amendment, and I have a motion and a second on the technical amendment.
I have a motion and a second for the resolution itself, but not for the amendment.
Okay, yes, because Supervisor Moresi, you added on the now where be it as. So if we can go back to just the technical, the inclusiveness changes, I'll take a motion for that amendment.
I'll make that motion. Can everybody hear me a little bit clearer?
That's a little better.
Okay. Thanks, Lee, for fixing that.
I need a second on that amendment.
I'll second that.
Seconded by Supervisor Hano. If there's no further discussion on this amendment, I will take a motion. I will call it. All those in favor of this amendment, the technical amendment, say aye.
Aye.
Opposed? Technical amendment, it carries. Supervisor Moresi, go ahead.
Thank you, Mr. Chair. So my amendment would be for the second, therefore be it resolved at the end. And in the last sentence, it says, Diversity Training Day for Portage County employees. I would like to add, and the Portage County Board of Supervisors to coincide with the MLK Day in 2022. And my reason being is that as policymakers, I feel that we need to be well-versed and educate ourselves in diversity, equity, and inclusion matters in our community. The only way that we can do that hand in hand with our employees is if we receive training as well. whether that be attending, coursework with our employees or by having guest speakers come to the Portage County Board of Supervisors and present to us. I think that would be a very important addition so we can make the best possible decisions based on information as it comes about and as we evolve and educate ourselves. Thank you.
That.
On the second whereas,
It's on the now therefore be resolved, also resolved.
down here.
The second now therefore after be it.
At the very bottom of the page,
Okay.
the last
I got
sentence.
you. I'm
Okay.
on board. Just
Okay. Do I have a second to that? I see
I'll second
Supervisor Robbie's raising his hand. I don't know if he's seconding it or wants to speak.
I want to speak, so thank you.
I need a second though on this first, so
I'll second it.
Supervisor Martinson, second it.
This was wrong from the rec committee, so this is not even what the. Dennis was right. Okay. Just the one that made- So that needs to be changed first.
This, I'm being told there's other technical amendments in this as well. Go ahead.
I can kind of explain it. So I received a couple emails and a phone call today regarding Supervisor Robbie's amendment that he made at the committee level. Apparently, the resolution text that's in the packet is not what he made at the committee level. So I was under the impression there was going to be an amendment tonight to correct it to reflect how he had said it at the committee. And then I guess I would recommend doing that first. And then if Supervisor Moresi wants to make an amendment beyond that to include county supervisors, that would be an additional amendment. So.
Supervisor Laddick.
Can we send this back to the committee to have them done right and maybe have staff look at it also?
Getting close.
Mayor-
Supervisor Splinter.
I also believe it should be sent back to the committee to get adjusted. I've had a couple constituents call me about this resolution where people have supported the Martin Luther King Day references, but when we get into the last two therefores, it's forcing training down the employees, all the employees in the county. We're talking 200 or 300 people being trained half-day session. And this is, as one constituent pointed out, more of an HR committee thing that should come up through a resolution through HR committee. The honoring the Martin Luther King and honoring the Hmong part is great, and that's part of the diversity committee's objectives. But when you're talking 200 or 300 employees and a half-day session and there's no real identified problem, I mean, the logic on it to push that domino to the second domino is that you should have a problem that we identified. And so far, I haven't heard any specific problem. I mean, if there's a specific problem with a specific employee, they can be dealt with by HR. But you're treating all the employees the same. And the cost on this, a half-a-day session for all employees, that is a cost to the county. And all these people, I've been in these seminars at Century when I was there, and just because you're in a seminar for 4 hours doesn't mean your work stops. You come back to your desk and you've got phone calls, you got emails, you're trying to catch up the rest of the day. So most people can't keep their attention for more than an hour in church, much less 4 hours here where everybody is inactive. I just think I was going to just propose that we delete the last two therefores.
If we're getting into technical, I don't even want to talk about another technical amendment. Right now, you're muddying up the water. I've got Supervisor Robbie, then Supervisor Moore. Supervisor Robbie, go ahead.
Thank you. Can you hear me?
Yep.
Good. Yeah, I was very much in support of this overall. The one concern I had was the last part of the second, therefore, where it says training sessions will be developed to the end of the sentence. I wasn't comfortable with that because it's kind of, I was not comfortable because I'm not aware of what is currently being done for staff training. And so I put in some different wording, which would give us some information regarding what is currently being done for staff training at all departments and at the county level. I think that's a good first step. We might find after that information that we have plenty of training regarding this issue. We may find that there's a big hole that we need to address. But before we ask our executive and the administration and department people to develop a training session on a given day, I'd like to know what it is we currently do. I don't want to do that in isolation, nor do I think it's fair to our executive to imply that, you know, we have to have training when maybe we're doing quite a bit already. For me, it's just I just need more information before I was able to support that second part. That's why we reworded a little bit, and my understanding is that it would end at countywide, both departmental and countywide training session, period, and it would not ask for the developmental training for all employees to coincide with Martin Luther King Day. Not that that won't be some time, we might look at some more definitive days for training, but that was not the intent of mine, at least, with that language, and I thought it was going to end at that point. So thank you. And I would not be uncomfortable myself at the time if someone suggested that we should go to a, bring it back to the committee. Thank you.
Supervisor Moore.
Thank you, Mr. Chair. I just wanted to just put in my 2 cents. I want to thank this board for, like really being open and being ready to move this county forward. I want to say, countywide personal development, not trainings, but personal development is very important. And it's not be looked upon as being forced trainings, but it's actually personal development. Either you're in this work for the county or not, you will leave the county being better. And so personal development is really important to me, and the county investing in personal development for staff is important to me. And this is very important to me that we take MLK Day as a day of in-service. Many organizations take this day as a holiday, but MLK Day should really be a day for many of us who are not Black to take this as an in-service day to better ourselves, to personally develop ourselves. And also, Supervisor Robbie, I agree with you too, though, that it should be developed, but other counties around us, such as Marathon County, other counties have developed trainings that we can also look to and take from. So it doesn't have to be reinvented, but that it should not be limited to just this day, but this day should be dedicated to in-service training, but it should also be looked as like our dedication to MLK and to our Black community and to our communities of color and our marginalized communities to get training throughout the year. So I would highly support everybody, rather this go back to committee or we pass it today, that we be in support in making sure this works. Thank you.
Supervisor Moresi, then Supervisor Johnson. Supervisor Moresi, go ahead.
Thank you, Mr. Chair. And I can definitely agree with the sentiment of Supervisor Moore. I also agree that with Supervisor Robbie that, perhaps we should coordinate a little bit more with HR on this, just so we're making sure our T's are crossed and I's are dotted, part of the pun with all the technical amendments. However, I do take issue with Supervisor Splinter's comments. His comments actually prove exactly why this Board of Supervisors needs training. Saying things like it being forced upon us, there's not a problem, it's too much time, how can we possibly pay attention to things that matter, such as equity in our community? This is incredibly important work that our county needs to do. Ignoring it will not make it go away, and ignoring it doesn't mean it doesn't exist. It is an issue that is systemically pervasive. throughout our community, and by acknowledging it and taking steps forward to ensure the equity and inclusion of all people in our community, we are doing the right thing as policymakers. So I would like to move forward with my amendment to include that. If people think it should go to HR, I would support that as well. However, it's very important that we do this work and we start now. Thank you.
Supervisor Johnson.
Okay, before this gets off the rails any farther, first, I apologize. In working with the executive's office and because the executive's office is helping staff this committee, which I'm deeply appreciative of, we sent the wrong resolution to the county board. The resolution with the wording that was approved by the committee, and now my dogs are going to bark, I apologize, that Supervisor Robbie had put forward and the committee approved reads as this. This should be an amendment to correct. This is what was approved by the committee. Now therefore be it resolved that the Portage County Board of Supervisors demonstrates its support of this legacy by requesting county administration present an overview of the county diversity training efforts, including both departmental and countywide training sessions. That is what was approved. Supervisor Robbie's point, let's find out what's happening now before we do anything else, which was approved by the committee. And to Supervisor Splinter point and anybody else talking about HR, you look to the scope of work for this committee, it included looking at HR policies that may impact diversity, inclusivity, have biases, that type of thing. That doesn't mean that we wouldn't work in collaboration with HR, but it is within the scope of this committee's work. So I believe that the intent as passed by this committee, underscored by the words of Supervisor Robbie in the original motion, should be that which is considered. And I apologize for my dogs.
Melissa, was that a motion? Was that a technical amendment or the motion? Was that a first?
Yes, sir. That's exactly what it is, because that is what what was passed by the committee.
Point of procedure, what's on the floor right now? I think we lost that. Did we ever vote on the technical amendment?
Yes, we've gotten rid of the first technical amendment.
And there's been no amendment made since?
This Supervisor Johnson has just made one now.
Okay, so I'm clear. I thought.
Yep, no, I'm thank you for helping me. I'm trying to keep track of them too. So I have a motion for another technical amendment. I will take a second.
Question, Mr. Chair.
Supervisor Morrissey.
Thank you. I did make an amendment too, but then Clerk Fellon said that we should take Dennis Robbie's amendment.
So this, yeah.
So I believe we're still on my amendment to add Portage County Board of Supervisors.
We need to toss this.
I'm going to take this off the table. I'm going to make amendment or ask somebody to make an amendment. I'm going to chase this around. I've got amendments stacked, and to me, that tells me that there's a lot of confusion in this. And I believe that it should go back and get cleaned up and be brought forward. This is not going to happen for 300 and some days, and there's plenty of time to get this cleaned up and bring it back. The other part that I will be at that meeting, and I would urge other supervisors to be there as well, but I do believe this should go in front of the HR committee, even though you have the charge within you. There are other financial issues that committees have charge of in their own budgets, but it goes through finance. So it's part of the chain of command, and I believe that this process, because it's in the wheelhouse of HR, they are the ones that are going to formalize the training. They're the ones that are going to be doing the work, and what the substance is in this training. should also have the ability to speak to it. So I guess if someone would like to make that motion, Supervisor Laddick,
I'll make that motion, as you stated.
to send it back to the committee.
Send it back to committee and include HR.
I'll take a second. Supervisor Dodge? All those in favor with aye?
Aye.
Opposed?
No.
Supervisor Johnson said no. Anybody else?
Yes, Supervisor Boa.
Supervisor Moore? Anyone else? Supervisor Martinson? Anybody else? 3 noes.
Nay, I'm a nay too.
Supervisor Moresi? That's 4. Supervisor Ande? Anybody else with a no? Motion carries. It's going back to the committee.
Yeah.
Supervisor Clinton, I'm not gonna go back and forth,
No,
so.
I'm not going back anywhere. I just have to respond to Supervisor Moresi's comments about my comments, that my comments were the reason they have to have diversity trainings, like I'm making racist comments. I'm really offended by that. I was just asking simple, logical questions. Why do we have to have it? Is this training effective? There was nothing racist about it. And I am offended that he used that as a reason why you need diversity training.
I
Thank
think an
you.
apology would be in order.
Moving on. And number 3, it's expressing appreciation for those employees who retired from Portage County in 2020.
Resolution number 71, 2020, 2022, submitted by the Human Resources Committee. This resolution recognizes and expresses appreciation to those employees who retired in 2020.
Motion by Supervisor Barry Jakowski, seconded by Supervisor Matt Jakowski. Supervisor Rakowski, did you like to speak?
Yes, we will go through the list of names. First on the list is Deborah Gilbert from the District Attorney's Office for 45 years of service. Shirley Simonis, County Clerk's Office, 44 years of service. Kathleen Genovese, County Clerk's Office, 42 years of service. Elizabeth Walensky, Healthcare Center, 41 years of service. Barbara Marcisik, Healthcare Center, 39 years. Todd McCuskey, Highway, 36 years. Delorma Nowicki, County Branch, Courts Branch 3, 35 years. Marianne Sankey, Aging and Disability Resource Center, 31 years. Tammy Check, Health and Human Services, 30 years. Kathleen Reynolds, Health and Human Services, 28 years. Elizabeth Hellbach, Healthcare Center, 26 years. Gary Katowski, Highway, 26 years. Lori Kovleski, Health and Human Services, 24 years. Corey Nelson, Sheriff's Office, 22 years. Michael Rayala Jr., Sheriff's Office, 15 years. Janet Roberts, Family Court Commissioner, 8 years. Maureen Porjaleski, Library, 8 years. Leslie Smith, Aging and Disability Resource Center, 6 years. Doreen Butterfield, Healthcare Center, 5 years. And Catherine Peach, 3 years. Now, as it states in the resolution, it's a combined 514 years of knowledge and experience that will be leaving Portage County this year and be truly missed.
$45, $44, $42 of those are unheard of in today's. So, we need to take any, we got a motion and a second. If there's no other further discussion, comments? All those in favor with aye? Aye. Aye. Opposed? Motion carries. Resolution authorizing 3.1 full-time equivalents FTE child welfare aides for child protective services.
Resolution number 72, 2020, 2022, submitted by the Health and Human Services Board and the Human Resources Committee. This resolution authorizes 3 full-time positions for child protective services.
Motion by Supervisor Dodge, seconded by Supervisor Gifford. Discussion. No discussion. All those in favor with aye?
Aye.
Aye. Did you have something, Supervisor Neville?
Yes, sorry, I couldn't move fast enough.
Go ahead.
In the minor, these are technical amendments. In the sixth, whereas the spelling of the word AIDS, there should not be an E in it. In that location, it should be AIDS. And in now, therefore, be it resolved, the letter A before 3.0 should be removed. That's it.
Well, it's kind of backwards here, but being were technical difficulties due to technology, I'm going to grant it. So we have a technical amendment, and Mildred has made a motion for some technical corrections. I'll take a second on the, seconded by Supervisor Dubek. If there's no further discussion on the amendment, all those in favor with aye? Aye. Opposed? Amendment carries. Back to the original motion as amended. If there's no further discussion, all those in favor with aye again? Aye. Opposed? Motion carries. Thank you. Number 5, resolution in support of increased child support funding.
Resolution number 73, 2020, 2022, submitted by the Health and Human Services Board. This resolution requests increased state funding for child support agencies.
Motion by Supervisor Zastro, seconded by Supervisor Dubek. Discussion.
I have a question.
Supervisor Neville.
On the signature page, there's nothing written by James Clark's name. I just wondered about that.
Oh, I'm sorry, Mildred, it's on the next page. It's not on the back of that one.
It's on the rent ready.
Oh,
She doesn't understand why he didn't sign, Mr. Chair.
It's on the rent ready.
He was not present at the meeting.
Oh,
so then it should say not present.
That's the next resolution.
I think you're on the next resolution, Mildred.
Sorry, just remember that when you get there.
Will do. Motion and a second here on this. I don't see it on here.
It's on the next one.
So
He's not a member of the committee. He passed away. That's why his name.
I'm back in it.
On the next resolution, he's on that signature page, but it's just
I
blank
see.
because he didn't.
Okay, thank you. Okay, we've got a motion and a second. Was there any amendments? No?
No amendments.
Okay, so we've got a motion and a second. All those in favor with aye? Aye. Opposed? Motion carries. You guys are really testing me tonight to see what we can handle. Number 6, providing funding support to Rent Ready as a relief program.
Resolution number 74, 2020, 2022, submitted by the Health and Human Services Board and Finance Committee. This resolution provides funding for the Rent Ready program for the year 2021 through contingency funds and through the annual budget for future years. And Mildred, yes, for the Health and Human Services Board, there is no signature for James Clark because he passed away.
Mr. Clark has passed. Motion by Supervisor Gifford, seconded by Supervisor Pataki. Any discussion?
Yes.
Supervisor Matt Jakowski.
Mr. Chair, I have a question. Maybe somebody will be able to answer this for me. Under the, be it further resolved on the signature page, it says that this funding shall be funded by contingency funds in 2021 and incorporated into the annual budget process for future years. Does that mean we're sticking $4,800 in here for future years? Or is it going to be looked at budget time? It's kind of confusing in how that reads.
Mr. Holman?
It'll be looked at every year. This year, the 4,800 matched an initial amount. If you added like a multiple person family and an individual, the services, that would cover that. But during the finance meeting, Mr. Cordes had mentioned too that he thought that maybe helping folks move furniture into new places, that was a lower amount. And so we talked about it, and I raised the issue to him too. I said that may go down to that amount in the future, be closer to where we fund some other non-county agencies. But yeah, it'll be looked at every year, and most likely will come down to match what he thought the funding would be best used for.
Thank you.
Anybody else have any questions? We have a motion and a second. Mildred, you got a question?
Well, didn't we put deceased by the name or absent or something? Not just leave it blank for the future?
In the future, we can do that if anybody is on a committee that passes away. Ray?
I just want to let, for Mildred's sake, I want to let her know. Sorry, I'm going to come to my.
Where'd our other mic go back there? Oh.
Who stole the mic?
Yeah.
So Mildred, the reason Mr. Clark's name is on there is because when this first went to finance, he was still alive. Unfortunately, he passed between the time it was at finance to the time that it came to HHS. That's why we didn't remove his name, because the original resolution had his name on it. You know, we do say yay or nay. He may have been there, but he didn't vote. And so we didn't, you know, Robert's Rules of Order didn't tell us if we should write deceased or not.
Abstain?
Maybe abstain. But that's the reason the name is.
Supervisor Dodge.
And he will be replaced, so there will continue to be this additional line with someone else's name probably next time.
Whenever we get the replacement.
Okay.
Thank you for the clarification.
Supervisor Barry Jakowski.
You did mean if the individual passed and not if the committee passed away, correct?
Right. Now we don't put passed. Okay. All right, we got a motion and a second. If there's no further discussion, all those in favor with aye?
Aye.
Opposed? Motion carries. Number 7, authorizing a personal service agreement with Stantec for wetland mitigation bank design.
Resolution number 75, 2020, 2022, submitted by the Highway Committee. This resolution authorizes an agreement between Portage County and Stantec.
Motion by Supervisor Laddick, seconded by Supervisor Matt Jakowski. Discussion. Supervisor Moresi.
Thank you, Mr. Chair. I do have a question for the Highway Commissioner, if I may. I'm just wondering if you could do us a favor and explain, down in the fiscal impact, it explains the different possibilities that we could go with, the $150,000 possibility and the $200,000. And it says the difference would be between if we do a full stream restoration or a wetland bank design. Could you explain that to the county board? And then if you could, kind of give us your opinion on what is best practice and what is preferred. Thank you.
Sure, so I'll just take a step back and explain the wetland mitigation bank process. So anytime that we disturb a wetland on any road, bridge, culvert project over a quarter acre of disturbance, we're required to mitigate it. So typically in the past, that was buying private credits from private banks Those costs we've seen have exceeded $70,000, and now they're going over $100,000. We believe through this project, we can buy land, design it, get it approved for 50 to 60,000. So ultimately, it's going to save the county money. The property that we're looking at has wetland bank credits available if we develop it, in addition to stream mitigation credits, which typically we wouldn't use, but if we develop it, that'd be a chance for more revenue for the county. So there's a good chance that we would proceed with the stream mitigation design as well, because ultimately it'd be a better fiscal situation for the county.
Thank you. If I may, can I make another comment, please?
Yes.
Thank you. It also said that you have 46 potential sites, narrowed down to 10 sites, but there was limited interest from majority of the owners. I guess what is holding owners back from participating in this program, in your opinion?
So the responses that we received, and we sent out surveys of property owners, followed up with phone calls as well. A lot of the acreage that we were looking at was tilled land, so they were still farming it and didn't want to take it out of production.
Okay. Thank you, I appreciate it.
Anybody else? Supervisor Dodge.
I was just curious, there's been some changes to land near that Little Plover River headwaters. New residents have clear-cut property off of Bluff Road. Does that impact your wetland mitigation plans at all? And has anybody evaluated what that action has done to that area?
No, that shouldn't affect the design for our property that we're looking at. Is actually downstream of there. So essentially our project for the Little Plover River watershed, it should improve. It will improve water quality. That's what wetlands do. It'll also help downstream drainage, where we will still allow the same amount of water to get through. It's just going to be at a slower rate. And the design, we've talked to the adjacent property owners, will be such that it's not going to have any negative impact on them.
I guess I was just curious because I went down Bluff Road one day and they were trenching behind one of the homes. And my assumption is once they clear cut the front, they may have had a water issue that they had to deal with differently.
Yeah, that'll be a private property issue upstream of here, so.
Thank you.
Anybody else? Supervisor Barry Jakowski.
Thank you, Mr. Chair. I just would like to thank the County Highway Committee and staff for bringing this forward and saving the county a considerable amount of money. So.
There's the possibility that in the long run, this can be beneficial and also be a good revenue stream, and as well be an area that helps that Little Plover River too. So it's got a lot of good potential for it. So if there's no further comments, Supervisor Matt Jakowski.
One thing I just want to comment, Nathan had commented that the other properties were agricultural land and people didn't want to take them out of production. This land is also agricultural land that will come out of production.
Right.
The other thing, this site compared to the other sites that we were interested in, looked at, talked about, fits better for a situation where with its proximity to the Little Plover River. With the money that's been spent, the work that's been done, this is just going to add on to the project in that area, take agricultural land out of production in that area, and again, make a healthier Little Plover River in the long run. So there may have been other people that weren't interested, but it's kind of a good thing that we weren't interested in because we landed in a spot that's ideal. And I don't want to speak for people that deal with a wetland mitigation bank or anything, but if you asked them if they could put a wetland mitigation bank somewhere in the state of Wisconsin, and you gave them this site, 10 out of 10 of those people that deal with that would say this is the site to do it.
Okay, if there's no further discussion, comments?
Thank you, Nick.
We got a motion and a second. All those in favor with aye?
Aye.
Aye.
Opposed? Motion carries. Number 8, conducting a countywide advisory referendum on clean water now for Wisconsin.
Resolution number 76, 2022, submitted by the Land and Water Conservation Committee. This resolution approves conducting a countywide advisory referendum for a right to clean water for Wisconsin.
Motion by Zastro, seconded by Gifford. Discussion. No discussion? All those in favor with aye?
Aye.
Aye.
Opposed? Motion carries. Number 9, resolution supporting increased state funding for aging and disability resource centers.
Resolution number 77, 2022, submitted by the Commission on Aging ADRC Board. This resolution supports increased state funding for aging and disability resource centers in Wisconsin in order to provide critical services for aging and disabled populations. I do have a suggested technical amendment. I'm sorry. The DHS secretary will no longer be Andrea Palm as of tomorrow. So the new person is Karen Timberlake. I would just recommend amending her name.
That's who it is now when we're going through the motion, though. Or, it's where it's going to be sent to?
Yeah.
Whether it's sent to, I'm sure she's gonna get other stuff and it's gonna be forwarded.
Just my recommendation, but take it or leave it.
Move to amend, Mr. Chair.
I got a motion to amend the name and the last, wherefore be it resolved.
Second.
Who seconded? So, seconded by Soik. On the amendment, any other discussion? All those in favor with aye?
Aye. Aye.
Opposed?
I didn't get.
They all said aye.
I didn't get a motion to approve.
Okay. I've got to have a motion to approve first on the floor so that we can talk about it. Motion by Dodge, seconded by Splinter. Okay. Now you want to restate your, or not restate, but you're willing to make your motion to amend?
I am, Mr. Chair, thank you.
Motion to amend by Supervisor Barry Jakowski, seconded by Supervisor Soik. Back to the original amendment. All those in favor with aye?
Aye. Aye.
Opposed? Motion amendment carries. Back to the original motion as amended. Any other discussion? Supervisor Gifford.
Yeah, I was glad to see this come up at the board meeting last week because in general, I think the legislature needs to hear from all branches of local government about the need for more funding from the state. So I was quite pleased that Director Petrosky brought this forward on behalf of, really, there's a whole association of ADRCs that have been calling for this for a long time, so it's a good thing.
Thank you. Anybody else? Back, did we take a vote on this?
Yes, before, but not.
So, all those, if there's no further discussion, all those in favor with the amendment, say aye.
Aye.
Opposed? Motion carries. I don't know if we did it once. Number 10, authorization for a 2021 contract over 100,000 for the Health and Human Service Department.
Resolution number 78, 2022, submitted by the Health and Human Services Board.
Motion by Honnold. Supervisor Honnold, did you raise your hand for that motion?
No.
Okay. Motion by Supervisor Dubek, seconded by Supervisor Medine. Discussion. All those in favor with aye?
Aye.
Opposed? Motion carries. I'll take a motion to adjourn.
Mr. Chair, before we go,
Supervisor Barry Jakowski.
do we know exactly what is causing our technical difficulty?
We're working on it. It's, we haven't had this in the past, so I think that this is something new.
Okay.
And we will work on it to try and continue to grow with our technology, so Motion to adjourn by Supervisor Rakowski, seconded by Supervisor Dodge. All those in favor with aye? Aye.
Aye.
Opposed? We're adjourned.
A video of this meeting is available for viewing on the city's website, stevenspoint.com/videos.